Hi, and welcome to the next video in our series on power habits for the menopausal transition. I'm Dr. Melissa Blake, and today we're diving into the topic of hormone replacement therapy and why the medical and research community have been prompted to revisit our approach to it. So hormone replacement therapy, or HRT, has been a controversial topic for years since it became the standard of care in the 1980s. And just like with many topics, we went from every woman everywhere using hormone therapy to a fear-based approach that drastically reduced the use of this therapy. And the result has been women suffering through menopause without proper symptom management. But with recent reevaluation of the research, we've shifted how we think about HRT. The two largest randomized trials on hormone replacement therapy are the Heart and Estrogen Replacement Study, or the HERS trial, and the Women's Health Initiative. These trials demonstrated risks associated with hormone therapy, including cardiovascular disease, blood clots, and breast cancer. However, two important considerations about these outcomes have since come to light. As we've already discussed, the average age of menopause is around 51 years. The average age in the WHI trial was 63, and the average age in the HERS trial was 67. So that means that the majority of these women were already well into menopause, and because of their age, they already were at a higher risk for cardiovascular events. The second flaw is related to the treatment goals. The goal of these trials was not exactly to determine if HRT was an effective solution for menopause symptoms, but rather if it was effective at reducing cardiovascular disease in postmenopausal women. Now the age range makes sense, but we can't directly apply the results to women in their 40s and 50s who are experiencing symptoms associated with menopause. When we look at the research through this new lens, it turns out that the timing of hormone therapy matters. In early menopause, hormone therapy can provide relief from symptoms like hot flashes, vaginal dryness, and night sweats, and it can also play a role in improving bone health, reducing the risk of osteoporosis. This new understanding has led to a shift in prescribing practices, with doctors now recommending individualized treatment plans based on things like a woman's age, her past medical history, and any symptoms she might be experiencing. If a woman lives into her 50s and 60s, she is guaranteed to experience menopause. It's not a deficiency state. It's a natural and normal transition in a woman's life during which the amount of hormones decline. Many menopause literate experts have now renamed HRT to simply hormone therapy to reflect this awareness. It's not about replacing what was lost, but about supplementing the normal lower levels as a way to manage symptoms. The point is, we don't have to suffer through. We need to have more nuanced conversations about hormone therapy and about women's health in general, including potential benefits and risks of any treatment option, as well as alternatives. It's important for women to know that there isn't a one-size-fits-all approach and that we are constantly learning more about this topic. With clear communication and understanding of individualized treatment plans, managing the transition into menopause can be a successful journey. Thank you for joining me, and remember, knowledge is power, especially when it comes to your health. Take care. See you next time.